Hi, this is your Houston chiropractor, Dr. Gregory Johnson. Our practice, Advanced Chiropractic Relief, is chiropractic in its purest and most simple form. And that's what I want to talk to you about today. The spine and the nervous system play an integral part in your health and wellness, and they also can play a deleterious effect and part in your overall diminishing health capacity over time if you do not take care of this structure right here, which is known as our spine. Pure and simple, the nervous system controls and coordinates the function of every organ, muscle, tissue, and cell in our body. The brain is housed up here in our skull. Some of us is harder than others. Then it comes down through a little opening here at the base of the skull called the foramen magnum and becomes the spinal cord. Now the skull, after the first 6 to 8 months, ossifies and becomes solid, so therefore it doesn't move freely. So therefore it protects the brain, which is the master control system of everything else. The spine, however, which houses a direct extension of the brain known as the spinal cord, has weaknesses. Those weaknesses are that there are 24 freely movable vertebrae throughout the entire spine. There are 7 vertebrae in the cervical spine, which most people call their neck. There are 12 vertebrae in the mid-back, which most people call their mid-back. It's actually called the thoracic spine. And then there are 5 lumbar vertebrae, which is what most people call their low back. Now at the base of these 24 freely movable vertebrae, we see that there are 3 big pelvic bones. There's a left ilium, a right ilium, and a middle triangular shaped bone called the sacrum. Most people call this their hip. It's really not your hip. This is the sacroiliac joint on the left. This is the sacroiliac joint on the right. The middle bone here, where it connects to the very last vertebra of the spine in the low back called L5, and this triangular shaped bone called the sacrum is known as the lumbosacral joint. Now at the very tip of our spine we have this tiny little triangular shaped bone that comes down, and that truly is our tailbone. It's called the coccyx. So, in review, the brain sits up here inside of the skull, sends this message through an opening at the base of our skull, right down through and inside of a canal that is formed by these 24 freely movable vertebrae. The spine, when you look at it from the front to back view as you are right now, is supposed to be absolutely straight. And these parts that you feel sticking out here on the back of your neck or your back, that's called the spinous processes. Those should be all lined up straight down in a line in a normally aligned spine. This is from the front view. Now the pelvis itself will be level across. This left ilium will be the same height as the right ilium in a normally aligned spine. They will appear the same size and shape from side to side. If we have normal alignment of our spine and our pelvis, which is made up of those 3 bones we just talked about, the nerves that come out between each and every one of these vertebrae can come out without being interfered with or pinched. When we look at the spine from the side, you will see that there are in fact curves that are present. Now these curves are absolutely essential and normal. When we look at it from the side like this, you have a curve forward in the neck towards your chin. You have a curve backward in the mid-back or thoracic spine, and this is our primary curve. This is what most people call the fetal position or fetal curve. And then at the base of our spine, in that low back area, which is known as the lumbar spine, again we have a nice smooth 63-degree radially loaded arc forward in the lower back. Now if you look down in the pelvis, you'll see that also goes backwards like the mid-back. So we have four curves in the side view. Forward curve in the neck, backward curve in the mid-back, forward curve in the low back, and then another backward curve down in our pelvis or buttocks region. Now, in between each and every one of these 24 freely movable vertebrae, except for C1, called the atlas, and C2, there is a shock absorber pad in between there known as the disc. The disc creates a shock absorption with gravitational weight bearing, and it also makes up part of the size of the opening where the nerves actually exit the spine. So in a normally aligned spine from the front view, which is straight, and then the curves from the side view, you can see how this relates to the posture that we talked about in our earlier videos. These joints fit together in an interlocking way like this. So they are actually responsible for weight bearing. If we have normal spinal alignment and biomechanics from the front view and the side view, the weight of gravity, the weight of our bodies, is distributed on the joints themselves, which are made up of bone. They are very hard. The ligaments, however, the disc in between each and every one of these vertebrae, is actually a ligament. Ligaments hold bone to bone. Muscles move the bones. There are 9 ligaments surrounding the entire spine from your skull all the way down to this pelvis. And then we have even more ligaments that hold the pelvic structure together, the bones. We have ligaments that hold our hip, and this is actually the hip joints in the base part of our pelvis on the side, which is this area where the leg or the femur attaches to our pelvis right here. In chiropractic, we call a condition of misaligned vertebrae, where the spine twists out of its normal alignment, subluxation. That means misalignment of one or more of these vertebrae, causing a pinching or interference on the nerves that exit out of that particular level. Now, these nerves supply specific organs, muscles, tissues, and cells. So if we have this condition known as vertebral subluxation, what will happen is, over time, whatever's at the end of those nerves, those organs, muscles, tissues, or cells will not function at 100% of their own capacity, and we call that in chiropractic functioning at a state of ease. If your body is functioning without neurological interference, we have internal environment of homeostasis. We call that ease. However, if you have vertebral subluxation or misalignment of the vertebra causing neurological impingement, therefore loss of function, we call that dis-ease. As you notice, when people get older, their spines start going forward. And we talked about this in some of our earlier video presentations as well. It's called forward head posture. When you're looking at it from the side, if you're sleeping on a big pillow that props your head way up, or you're looking down on your computer all the time and reaching forward on your computer or using your mouse all the time, you will start developing this posture. Now, gravity's constantly pulling us down towards the earth. So over time, gravity is going to start winning this battle and causing degenerative changes in the disc or the shock absorber pads, the joints themselves, and then the nerve openings, which are made up of a vertebra above, the disc in between, and a vertebra below. They start getting smaller, causing more and more neurological interference, which will eventually develop into dis-ease, abnormal function. Now, most people think that when you have a pinched nerve, that it's really going to hurt. And pinched nerves do really hurt sometimes, but this is a fact. Only 18% of all the billions of nerve fibers that we have going through our body carry pain messages. The other 82% carry function messages. They're telling our heart how many times a minute to beat, our lungs how to take in oxygen and expel carbon dioxide, our stomach how to secrete acids or bases or whatever chemical processes are necessary to digest our food. Out of the lower back here, it supplies our large intestine, our urinary bladder, our organs, sex organs, our small intestine, large intestine, kidneys. All those things are supplied out of the lower back region. Now, if you have no nerve interference, you're going to function at a high level of function, and it's going to be in a state of ease or health and wellness. If you have vertebral subluxation, you may or may not feel pain with it. That's the dangerous part. There's two things in this medical, quote-unquote, industry that are known as the silent killer. One of them is heart disease. 75% of most patients who die of heart attack, their very first symptom is they drop over dead. Now, vertebral subluxation is also known as the silent killer because only 18% of all the nerve fibers in our body carry pain messages. The other 82% function messages. So you can have neurological interference, dis-ease, and not feel any pain with it at all. So that's why we educate our patients to evaluate their posture, which is a mirror of your spinal biomechanics, get adjusted regularly so that we can allow the nervous system to function at its most optimal level of function, increasing your level of performance, increasing your body's ability to maintain homeostasis or a normal internal working environment, and then keep it there. Because we spend a third of our lives sleeping. And either you sleep properly and you're keeping your spine and nervous system healthy, you're sitting properly in your chair, and gravity is still here 24/7. You're either strong and stable in it with the joints holding you up, or you're weak and unstable. And guess who's going to win that battle over time? Absolutely, gravity. So, what I want to get across with you is that chiropractic is so pure and so simple. It's like turning on a light switch. You're either getting 100% of the neurological message out to your organs, muscles, tissues, or cells because you are lined up properly, you're well adjusted, so to speak, or you can develop disease processes over time as a result of vertebral subluxation, the silent killer. The nerves out of this upper back region here, where most people feel so much stress, supply your heart and your lungs. It's not a coincidence that people who have heart attacks or heart problems have pain that shoots down into their arm, and weakness in their arm, and numbness and tingling in their arm. The nerves that come out of this lower neck, upper back region not only supply into our shoulders, all the way down in our arms and into our hands and fingers, but they supply our heart and our lungs here. This is where most people feel stress, right at the base of their neck and upper back. So what we need to do is keep our patients lined up, stabilized, and then teach them normal postural biomechanics while sleeping, sitting, standing, walking, driving, studying, working on the computer. No matter what you're doing, you always want to be mindful of how to keep your spine in a strong and stable position. Normal nerve supply, normal function. Abnormal nerve supply, abnormal function. Chiropractic, pure and simple. It's not just about neck pain or back pain. It's about a state of well-being and a state of health. Not fighting illness, but staying well. This is your Houston chiropractor, Dr. Gregory Johnson, and it was a pleasure speaking with you today. Thank you for watching.